So we have some exciting news, don't we? We are going to be starting Botox in our clinic and non-surgical treatment, which we have decided it would be a good way forward in view of all the things that have been happening with regards to regulations of Botox, but we will be doing things slightly differently. We know a significant number of people have already had Botox and fillers. And one of the things that can happen is that to get the exact anatomy, it can be sometimes difficult to know if they've had surgery, if they've had fillers, so you don't always know you're putting it in the right place, particularly around the eyes, even around the lips. And we've seen a lot of complications, not from here, but from other places where people are injected in the wrong place. But what we do here is different. We're going to do ultrasound-guided injections, which means that when we inject, we will know exactly what plane or what tissue we're going to be injecting in. And importantly, we know the greater surety that we'll be avoiding the blood vessels, which you don't want to do. And if you inject in blood vessels, we get lots of complications like infection, necrosis, and that's something we definitely don't want. So you've had experience with non-surgical treatment with us, haven't you? Tell me how your experience was.
I am pro because I think at my age as well, I'm in my 40s, I feel like it's a nice time to start Botox. I didn't do it before then, but I really like it. It makes me feel fresher. Love Botox.
And I try and do a conservative approach, a safe approach.
Yeah.
I don't put too much one.
You don't put that. No, you are really good, to be fair. I've had Botox for the last few years, and this is the best that my face has looked.
Good.
You don't overfill. Sometimes I've had it before in the past, but my brows can really be prominent. It looks a bit weird.
Yeah. And with skin, it's multiple things. So you've been doing other stuff as well.
I've been doing other stuff too.
You've also had
PRP, red light frequency, radio frequency.
Yeah. But the Botox is the one that helps remove the lines of the face, which is what you're really keen.
I know.
And the other thing that we did a Nefertiti Lift.
We did. And I'm really happy with that.
You like it?
Yeah.
We did a very conservative approach, which means we didn't overdo it. And what that does, it kind of defines a little bit more of the jawline. And how was the feeling of being injected?
I'm fine with it.
Yeah.
No pain, no gain. So I'm quite happy with it.
Yeah. And there are lots of different types of Botox out there. There's cheap Botox and not so cheap Botox. And the ones that aren't so cheap are established. They've been here around for years and years and years. They've got a good history. And they're with companies that we can contact. And we always use the slightly more established Botox in the medical industry, which is what you had. We don't use the not so established ones. So that can vary between one place to another.
And I think you should, I never knew this prior, but you should really know what Botox is going into your face and how much of it is going in.
And when you had your Botox, how long do you think it took before you...
So everyone's different, but within 24 hours, I can start noticing it on my face. But I have friends who it can take up to a week, but mine's quite reactive quite quickly.
Yeah. And I think that's... People who have had lots and lots and lots of Botox in the past, it becomes less effective as time goes on. And also, if it hasn't really worked, it might be because you've been injected with the not so established Botox companies or neurotoxin companies. But from my experience, the Botox that we use tend to be quite effective, except in a few patients that have had it for over 10 years, and it can be a bit difficult because they need lots and lots and lots of it.
But I love it, so I get booked in.
All right then, so it's lovely seeing you all, guys, and hopefully we will see you in the next video.
Yeah.
Bye.